Welcome to Bart's Medical School at Malta. My name's Angela Rowlands, and as well as being a senior lecturer at the medical school, I'm the head of the Academic and Pastoral Support Unit. Bart's Medical School in Malta is a great place to study. You have an excellent academic staff, a state-of-the-art medical school, all set in beautiful Gozo. However, during a 5-year course, it's not uncommon for the odd hiccup to happen or something to happen in your life totally out of your control that can sometimes affect your studies. The Academic and Pastoral Support Units are here in the background to support you should you need it. Sometimes settling into medical school can be difficult, especially if you're moving to a new country. Sometimes students struggle with the fact that there's so much to learn, new and different ways of learning, teaching and assessment. They find more directed learning can be a challenge to them. The learning is different. They learn in clinical placements, which is a new way of learning. And there's this whole new issue of being a professional that some people struggle with when they start in medicine. Medical school is a very competitive place, and sometimes people come to medical school and they've always been A-star students, and then they meet a lot of other A-star students and suddenly they find that they're kind of mediocre students compared with other people, and sometimes they struggle with that. So it's important people learn to look after themselves when they come to the medical school, and sometimes that's difficult because it's sometimes for some people the first time they've lived away from home. Moving to a different country, they might come from a different culture and that might be strange. Some people come to medical school and wonder after a few weeks whether medicine really is for them, and that can be challenging. And also for some people, life happens. Things totally out of your control happen in your life, maybe to your family back home, and that will interfere with you settling into medical school. The Academic and Pastoral Support Unit are here to help you with those things. So who are we? So there's myself, Angela Rowlands, the head of the department, and I have a deputy, Dr. Hayley Derricott, who helps me. And also in our department we have a mental health coordinator. Now the mental health coordinator works with a small number of students who have issues that need more frequent support to help them through the course. However, you don't need to have a mental health problem to see the mental health coordinator. Like all of us, you just need to make an appointment, and we will listen to whatever you need to talk about. Our services are roughly divided into two aspects of support. Firstly, people often come to us for pastoral support. So this might be emotional issues or mental health issues. It might be simply people feeling a bit homesick or having a difficult day, to more serious mental health issues. People come to us because they're worried about the health of family or friends back home, and that's affecting their ability to study. Some people find themselves in a situation where they have a problem at home that needs them to go back and sort out, or they're unwell. And so they come to see us and we discuss how they might interrupt their studies so they have the time to be away and put things to rights or get better, and then return to studies when those issues are sorted out. So we have policies to support people like that. And of course we see people when they return to their studies as well, so we keep their place at medical school open until they're well enough, but then they come and see us so we can assess how they're doing before they return to their studies, to make sure they've got a package of support there if they need it. Some people come to us because they failed exams and they might feel that the failure is something they want to appeal against, so we support them through that. Some people just come to us for general guidance about aspects of the course. Students get pregnant during the course, so they come to us for support, how to cope with that. And some people come to see us because they have specific learning differences. They might be dyslexic and need some special provisions put in place to help them. Or they might have some kind of disability that we might need to take into consideration to for them to study in the medical school. So we can assess people for all those things and put measures in place to help them if necessary. Some physical disabilities might be long-term, people who come to us with long-term problems. Sometimes it might be something like people break an arm or a leg whilst at medical school, and for a short time they need a little bit of extra assistance. The other aspect of our support is academic support. Obviously, lecturers are available all the time outside lectures to go through things or answer questions for students and give people extra support if they're unsure about anything. We also have a senior tutor scheme. So each year has a senior tutor. And if students are struggling to progress, they often get to see the senior tutor who draws up an action plan that will help them along the way. Whilst at medical school, you will all have a MedPro supervisor. The MedPro scheme is a little bit like a mentor scheme, but a bit more detailed than that, and it has two aspects. So a MedPro supervisor is an academic or a clinician who will work with you throughout your course and develop a personal development plan with you, and kind of keeps an eye on your academic but also your professional development. And there are two aspects of the MedPro programme. One is your academic development, and in that we often put extracurriculum lectures on, things of interest that might sort of give you a bigger sphere of interest in the medical field. But there's also an aspect in the MedPro programme that we call WellMed, which is all about your personal development. So how you look after yourself as a person and cope with being a medical student and a doctor. And again, we encourage extracurricular activities such as voluntary work, and develop a portfolio that helps you to add all these extracurriculum activities into a portfolio of evidence to show people when you're in the future thinking about jobs. We also have study skills tutors who come to the medical school to support students who are struggling with their academic work. And some of our work is just signposting you to the relevant people. So we may listen to you, and we may not have all the answers, but we may signpost you to some specialist support. So if we feel students might benefit from a dyslexia assessment or dyslexia support, we would give that, we would refer them on to a specialist tutor. Some students might benefit from counselling, so we have counsellors who we can refer students to, and students talk to counsellors in confidence outside of the medical school. We've talked about the study skills tutors. We have occupational health, where if medical needs need assessed, that's done through that department. We have an accommodation officer for students who are living in student accommodation to assist you with issues there. And we have a careers department where we regularly put on careers seminars for our medical students. Some students worry about asking for help or admitting that they're not well, and they often think that this will have a negative impact on their course. The reality is quite the opposite. We all get ill now and again, and the General Medical Council recognise that, and as long as you seek help, it's not a problem. It only becomes a problem when doctors and medical students become ill and then don't seek help and don't look after themselves. So please be reassured that the Academic and Pastoral Support Unit is a confidential service. The small caveats to that are, if you obviously come and tell us you're going to hurt yourself or hurt somebody else, yes, we may well break that confidence, but otherwise the service is confidential. We don't tell your lecturers or your senior tutors about any of the issues that you discuss with us without your permission. We're not your doctors, we can't diagnose you or treat you, but what we can do is signpost you on to people that can help you. We are not involved in your assessment or academic progression in any way. So some people worry about coming to talk to us because they think, oh, if we now know that your problems, you might hold that against, we might hold that against you if we're assessing you. That's not the case. We're not allowed to be part of your assessment and make decisions on your academic progress. So whatever you tell us won't make a difference to that. We very much look forward to having you at Barts Medical School in Malta and welcoming you to your MBBS programme.